fresh eyes that Catherine alluded to. Before this week, I couldn't tell you the difference between a clean utility and dirty utility, or even the fact that there was a need for that. So I had a great team. This was truly a collaborative effort. So, all right, if you look here at the prompt care, I'm going to be speaking a little bit about the prompt care layout and design. So one of the things that we just heard is about the lack of waiting area for the patient. So the first thing I want to point out that this area here is not a patient waiting area. This is a family waiting area. This is a spot where the family can come in and wait while their loved ones are being cared for. We really wanted to incorporate the whole Mountain Lodge theme to tie into the exterior of the building. So you see you have the fireplace, you have the seating around that, and it's going to be the outside windows. It's going to look great. It's going to look just like that welcoming, comforting area to be in. Who said? All right. So some of the right over here on this side over here. So some of the features that I want to point out.
That's me.
I wish.
Right. Yeah, the receptionist area out over here. And, for the record, somebody else placed that there, that wasn't me. All right, so we have all of our exam rooms and procedure rooms centrally located. None of them are located on an exterior wall, so there won't be any kind of noise issues. We have a collaborative area in the back for the nurses station and the providers, and also an area that the provider can go into to do some dictation or a conference room if some privacy is needed. Right back over here. Maybe I was right back over here. This area in the back over here is a secure staff area. Due to the nature of the business, the clientele and the business of prompt care, a lot of times the staff isn't going to be able to go up to the third floor, the other side of the building, to sit down and eat their lunch or take a 5-minute break. So we felt it was really important to incorporate that idea into this plan. Over here on the side, we have a separate staff entrance, and also could be used for EMS entrance if there's a need to extract or transport a patient. There you go. Hey, I'm an IT guy. Come on. That's right. That's right. So again,
you're doing great, Joe.
Okay. So there's a very short distance right here, a very private area for that patient to be able to transport that patient out of there. There's going to be secure doors here and here, right? So one of the other things that we want to point out is that, again, due to the nature of prompt care, that after hours business, and sometimes it can, get a little sketchy, there's a emergency exit, if you will, for the PSR, that they can kind of come back into the triage room, close the door, and secure the door, and they're out of harm's way there. All right, last thing I want to talk about is patient flow on this. Patient flow is really important on the design of this. We want to keep it easy, we want to keep it simple, and avoid that kind of rat in the maze type of feeling when you step outside of an exam room and you need to figure out, how do I get out of here? And I think everybody here has kind of experienced that at one time or another. So it's a very simple, basic circular flow. The patient comes in the main entrance right here. They check in with the PSR. They're brought back through the secure door. They're placed into one of the procedure exam rooms. And additional things if necessary, like X-ray, they can just come right down the hall and right into the digital X-ray right there. Can come back and wait and speak with the provider and go from there. When they leave, they step out of the room. They can either go to the left or the right. Ideally, it's going to be that circular flow, but you can design whatever you want. The patient is going to do whatever they want. So come out, right? And even if they go left or right, they're going to be led right back to the entry or exit points. Okay. Also, one of the things I want to point out is that the pharmacy window is right here, right inside the lobby area of prompt care, so that by the time they walk out of here, that prescription, which has already been electronically transmitted to the pharmacy, is going to be ready to pick right up, so they can
pick up their meds, check back out if necessary, and then leave. And now here's Keith to talk a little bit about the pharmacy.